I'm Mr Ankur Barua. I'm a consultant ophthalmologist with a specialist interest in refractive and corneal procedures. I also do cataract surgery as well, and work in Midland Eye. I'm also the corneal lead in Birmingham Midland Eye Centre as part of my NHS practice. The first memory I have of thinking about doing ophthalmology was when I was a second year medical student. So I trained in Manchester in the university there, and in my second year we had a special study module, which is where we elect to follow a patient around. And this patient had very low vision, and so I followed the patient as part of his daily routine, and then as part of his flow through hospital going to the low visual clinic. This patient obviously didn't have much potential for improvement in vision, so it wasn't a case where the vision could be improved, but it really opened my eyes per se to the role of ophthalmologists and how many different subspecialists there are within that speciality. So that really opened my kind of eyes to how ophthalmology works, and I got fascinated by it. So after that I developed a further interest, having spent a period of time in Harvard University. So I did a final part of my training in Harvard University, where I was attached to ophthalmology specialists and professors. I'm passionate about ophthalmology in general, and actually being a doctor in general. So the first thing is I chose to become a doctor, a medical person, helping patients, helping people, trying to focus on that side of things, so making sure I understand how the patient feels and the outcomes of patients. Secondly, I'm a surgeon, so I really am a surgical person. I really love the fact that you could improve somebody's vision and improve somebody who's got limited vision. And then finally, I chose to be a corneal specialist, so I'm a corneal surgeon. My passion is corneal transplant surgery and anything to do with anterior segment. I initially did actually train in cornea and glaucoma, but I chose to focus my efforts on corneal practice and refractive practice, which is where I am today. So the fascinating thing about ophthalmology is it's got so many different subspecialities. In corneal disease, even corneal disease have subspecialities. So we've got dry eye, we've got corneal dystrophies, we've got corneal refractive procedures, which is where people want to get rid of glasses. So I'm kind of a specialist in all those areas, and there's a huge amount of things can be done. In terms of my passion, really something that we do a lot of is corneal transplant surgery, and this is where we use not yet artificial corneas, but corneas that have been passed on by somebody who's passed away and willing to donate their corneas, and we use those corneas to be able to transplant into patients who need them. So patients who have corneal disease where there's a part of the cornea that's not working properly, and we aim to replace that cornea with a part of the cornea which is working properly. So basically, the amazing thing about the cornea is that it's not traditionally vascular, so it hasn't normally got blood vessels. So it is actually usually one of the most successful parts of the body to be transplanted. So my main passion is corneal transplant surgery, and that's why I offer here in Midland Eye as well.